with operational responsibility for all of the clinical, or most of the clinical and non-clinical support areas. So that would include places like pharmacy, radiology, labs, so on and so forth. So I do have operational background, and certainly, hopefully I can be helpful to you, the clinical readiness owners, as the project moves on. So the purpose of the call, like I said, was a touch point. We had canceled a number of the EPIC directions sessions, which were sessions that were scheduled to for us to get together and to review Hackensack's Visio workflows and then comment on them. But those sessions have been postponed for at least another 3 months while the total EPIC project plan is being reviewed by an outside consulting firm. As we moved along in the project, we realized that we probably just needed to reconfirm the plan and make sure that everything was
Hello.
Hello.
Hi, it's Jennifer Breedel from Riverview Medical Center, the Stork.
Okay, thank you. So in place of these direction sessions, it was felt that it was a good opportunity for our operations team to become familiar with the Hackensack system, which is also going to give you firsthand knowledge for any interactions that the consultants, you may have with the consultants in the future. And so if you're following me on the PowerPoint, I'm just going to kind of review where Hackensack is with regard to their 2016 EPIC rollout. For those of you who were not aware, Hackensack was not up on all of the clinical modules, and they also were up on a different EPIC version than the one that we will be going live with. So they had to upgrade to EPIC version 2015, which they did very, very successfully on February 19th. And then there is our plans to go live with the anesthesia module, which was scheduled or targeted for March, but there has been some delay due to, believe it or not, a facility issue which has to do with electrical capacity in their ORs. And so that's being sorted out, and they will hopefully have a new live date once that work can be completed. The next module that's scheduled to go live is the Cupid or cardiology module, which is scheduled for April. Then the oncology or Beacon module, which is scheduled for July. And then finally the Beaker module, which is scheduled for October. And then that will have them, then they will have the full complement of all of the modules live that we plan on going live with during our implementation phase. Now, I will take questions at certain points because I know there's a lot of you on the line, and there's a lot of information here. So I'm just going to finish this thought about how we're going to get familiar with the Hackensack system and how we're going to create our own little work groups so that we can make sure that all of the campuses have good representation in this whole process. So the first thing that we're going to ask is that you, the readiness owners, reach out to one of your peers from each campus. So that would be, for instance, if I'm an anesthesiologist, I would reach out to an anesthesiologist, or, you know, that would probably be the best person to reach out to, an anesthesiologist from each of the 7 campuses, and create a little work group so where you can start to share information. Those teams, at this point in time, we're not inviting all of the subject matter experts, the SMEs. However, if there is a SME on the list, and we're going to go over the list a little bit later on, that would be a good member and fits into your work group, you can certainly use one of the SMEs. And we'll talk about that a little bit more as we go on. I will distribute contact information for the appropriate Meridian EPIC module IT team leads and we're going to look at a spreadsheet later on that's going to actually have their names, but I will give you the contact information for both them and for your Hackensack mentors, which that's what we're calling the people, the operational people at Hackensack, which we're asking you to work with to set up some site visits. And we're also going to show you a little bit later on a tool that we're going to ask you to complete after the site visits that's going to kind of walk you through the things that you should be looking at. And we'll touch on that in a little bit. So it's going to be very important that you try to, as you develop this team, that you try to schedule site visits at Hackensack and try to go up as an entire group so that you can discuss things and feed off of each other while you're up there, and so that you can complete the report together, because we're going to ask that the report, really look at any issues or comments from each of the campuses, not just one comment in total. I'm going to ask that you submit the site visit dates and who's going to be involved with that site visit prior to the event, just for informational purposes and so that I have contacts. The visit it should include actual observations in the functioning work areas, and Bob Ravansky and myself are going to be speaking to the Hackensack mentors to discuss with them what we're hoping to get out of this, which would include those actual live observations. And I'm going to facilitate after these visits a debriefing session where we can look at everybody's comments and results, and then that will kind of dictate any follow-up activities and help us organize a more targeted follow-up visit to Hackensack, after that initial one. Each work group will be expected to make at least 2 site visits with no upper limit, and the window of time that we're looking to do this, to accomplish this, would be between March 28th and May 13th. So that gives you a pretty good window of time to be able to at least get those 2 site visits, and if you think you need more than that, you could arrange to have more than that. The results of these visits are going to be shared with the appropriate IT work groups and also the outside consulting group. Now, obviously, there's some benefits to this. Some of the benefits are that the operational work groups representing all campuses are going to be formed. They're going to get to know each other, and they're going to get to begin to work together. So, that's going to be important because we know there are differences between the campuses. As much as we're alike, we also do have, some similarities and some nuances that need to be addressed. These operational work groups, the ones that you form, are going to be introduced to your Hackensack and Meridian IT contacts. As I said, I'll give you contact information, and we'll make sure that you can get in touch with them and have some dialogue with them. These work groups are going to have the distinct advantage of observing the Hackensack model in a fully functioning live setting versus looking at a workflow on a piece of paper. And we feel that that's a big advantage. And then there's also going to be the opportunity to interact with the actual Hackensack operational personnel in their work environments. And those work environments are going to be work environments that obviously you're very in tune with, because they're going to be the work environments that you work in every day. So lastly, just to kind of recap the Hackensack lives. So anesthesia was scheduled to go live in March. We don't have an exact date on that, but we believe it'll be fairly soon. Cardiology, April 1st or thereabouts. Beacon, July 1st or thereabouts. Beaker, October 1st. Those, if you're part of any of those modules, we're going to ask that you don't don't have a site visit until the modules are live and stable. What you should
to clarify something for me. If your name is a readiness owner, for example, for myself, I'm Jen Bredel. I'm for the Stork, but I was involved in answering questions for some of the other modules. So, I guess I'm a little confused. I stay with Stork, correct?
Yes. We'll go through the spreadsheet, and I think that will clarify some of that.
Okay. All right.
And I'm almost at the end of this first cutoff where I'm going to ask for questions. So I'll open up questions in a minute. No problem. So these modules that are what we call the in-flight modules, the ones that are not up and operational right now. So if you're in one of those work groups, we're asking that you spend the time right now to first of all develop your own work group or your network, and then to start discussing amongst yourselves your intercampus similarities and differences while you're waiting for these modules to be live and stable. And what we're also asking is if we can arrange, we would arrange for you to go to Hackensack during their go live, so that you can actually have a look at that and what that looks and feels like and how it goes, what some of the good things that they did are and what some of the things that could be improved are. So maybe at this point I will just stop, and I know I gave you a lot of information, so I'm going to ask if people have questions. And there is going to be some additional information, as I just mentioned earlier, that's going to give you some more clarity on who all of these different people are: readiness owners, subject matter experts, eventually super users, all of that kind of stuff. But I'll open it up right now for any questions.
And Bob, this is Bob Ravansky. So I just wanted to add something. So for those in-flight modules, specifically Cupid, Beacon, and Beaker, as those things are in flight, there's meetings that are going on about, build decisions and stuff like that. And we're also working with Hackensack. Our analysts are working out on a schedule so that we're up there a couple days a week, and Hackensack is down here a couple days a week. Why those meetings happen, we're going to look for opportunities to kind of engage those readiness owners to be part of some of those discussions that are happening in flight. So as much as you may not be going up to do the site visits like Bob had mentioned, we're also in this interim going to try to find some opportunities to kind of get you plugged into those in-flight activities. So.
Thanks, Bob. Does anybody else have questions before I move on to I was going to move on to the site visit report, which also was one of your attachments.
I guess where does the project leader come in over the readiness owner in terms of the site visits?
The project leader, now when you say the project leader, you're talking about Bob Ravansky, or he's the project manager?
Maybe it's project manager, and I may be getting too specific too soon, but I know that Pat Dursky is over the Stork package or the Stork module.
Oh, you mean the app lead? You're talking about the app leads,
yeah.
So
we'll review that too on the spreadsheet, and I think that will become clearer. But you guys are the readiness owners, so you're really on the operations side. You're obviously going to be working with the IT folks, but they're not necessarily, they're not necessarily the manager for that module, if that's what you're asking. Bob, do you have anything?
Yeah, I think Jen. So and Bob's going to touch on this, is actually part of the instructions that are on the site visit report. But when the teams go up there, in addition to the readiness owners getting one peer from each of the campuses, we're also going to have the app lead, right, and what we call our system specialist, which is synonymous with principal trainer, to accompany that team to be there as well. So, the team that ends up going to Hackensack is essentially a group of 9 folks, one from each Meridian campus, and then 2 folks from IT, and those 2 being, you know, the app lead and the system specialist / principal trainer person. In addition to that, you know, Bob and Joy and some others will be at Hackensack as well for some of these things, but, you know, the core team, if you will include those 2 IT people.
So as a readiness owner, am I the one that coordinates those 2 site visits up to Hackensack?
Yeah, actually, your questions are awesome, and I think, Bob, maybe this is a good opportunity to go straight to the site visit report, because everything that's been asked so far is really addressed there. So maybe step through that, and then we can come back again for some questions.
Okay.
So I guess before and saying that, I just want to make sure that folks have access to it. So I think, Bob, you attached it to the meeting invite as a separate thing. So if folks have that open while Bob steps through it, it'd probably be helpful.
Yeah, and I had asked, you know, some of you may have printed it out too, because I had suggested you might want to make notes. But anyway, so we're looking right now at the site visit report, and there are instructions where it begins out. You know, the site, it says that the site visit report is you know, to be filled out. You know, it's going to be filled out by each representative from each campus. But to answer your question, the question that was just asked, you as the readiness owner will be the one who will reach out to the different campuses to form your work group or your team, and then to contact the Hackensack mentor to set up a site visit. And we can talk more about that, and certainly if after you know, after you've had a chance to digest this, you want to call me, email me, contact me, you know, we can walk through this again. But so we mentioned that we're looking for at least 2 site visits, but you can have more if you need. Because we're really wanting the team to have a really comprehensive exposure and understanding of that Hackensack system, and so we are. And on this tool, this visit report, we do have slightly different visit windows. We say that the visit window is between March 21st and April 29th. And because we weren't sure whether we would have all of the Hackensack contact information available, we kind of extended that, rolled it across by about a week. So in the other document we said that the start date was March 28th, and I believe that it would go through April.
May 13th. Yeah, May 13th.
I'm sorry, yeah. So here again, it's going to be really important to be inclusive of all your peers, because that's what we're counting on to make sure that all the sites are represented fairly and completely. Initially, when and we're going to show you the team readiness owner and SME list was made, not all of the campuses were evenly distributed. Excuse me. So when we go up to the Hackensack, we have on this sheet some suggested visit agendas. And we're asking that you get involved with the operational people and find out these things, because each of these things could definitely, if Hackensack does things that are staffed differently, has different policies, procedures, it could definitely affect whether or not, you know, we would be able to use their system as is. So stepping through this, visit number 1, we're asking that you take a brief tour of the facility, look at the work unit's organizational structure, have a general discussion of the unit's scope of work. Do they do more things, less things, hours of operation, staffing, space, equipment, etc. All those things are going to be important. Discuss and observe patient and staff workflow. Does a department have centralized or departmental transport? You know, does the department have its own schedulers? What kind of automation do they have? What's the geography of the area? How do they use their volunteers, if at all? Does their teaching program impact things? What are the responsibilities of the different job categories? And do they have any outsourced services? So there's going to be, hopefully there's going to be a lot of discussion, and you're really going to have a good understanding of that department. In addition, we're asking that you discuss and observe order processing, clinical documentation, decision support capabilities, policies and procedure differences that might impact your efficiency and workflow, and then, of course, the review of charge processes, which sometimes is forgotten but is very important. And then for visit 2, we're going to after we do a debriefing, we're going to, that's kind of help us to understand what we want to do and see for visit 2. But we're also going to try to look at and observe patient flow and transitions of care, both upstream and downstream from your department. So places like the OR, ED, nursing units, registration, scheduling, diagnostic testing, procedural areas. All those things are going to impact, you know, how your department interacts with that Epic-built Hackensack system. You're going to discuss various reports. What type of third-party systems do they have in conjunction with Epic? You're going to discuss, you know, different workflows, and are they changing anything right now? Are they in the process of changing anything as a result of their going live with Epic? And then just discuss with them and their opportunities that they would give to you for, you know, changing things or improving things. And then you may want to discuss a little bit about their training and super user program, and some of the IT people that will be with you will also be interested in that. When we ask you to fill out this form, we're going to be very specific and ask for the exact people who attended and their department and their title, and then who were the Hackensack people. And then there will be some general questions like, you know, what departments and areas did you visit? What, if any, of the recommended agenda items were you not able to complete? And then answering from the perspective of the different campuses, what was the overall impression of Hackensack Epic system? And, you know, we want you to be fairly detailed so that we get a sense as to, you know, how happy and how usable is the system. What aspects of the Hackensack system performed better than the existing system? We're interested in that also. What aspects of the system need further review or additional research? And that some of that will bleed into our second visit. And then, very importantly, were there any patient safety, regulatory, or business concerns that would need to be worked through? So after this is done, we should have a fairly comprehensive idea of our impression and the usability of the Hackensack system. And we should also have made some good contacts at Hackensack in your departments, the departments that you come from, and be able to have any kind of ongoing dialogue that you might need above and beyond these visits. So here again, I mentioned a lot of things, and so I'm going to stop right there again and ask if there's any questions.
And Bob, this is Bob again. I apologize. I just want to jump in and just add something before we get into the questions. So as Bob stepped through the report, I just want to reemphasize that, you know, this is going to be submitted electronically to Bob. So as readiness owners and you form your peer group, you want to ask your peer group to send to you, right, an email or or in their own document, their comments, and then as a readiness owner, you would take their comments and paste it into this master document and then submit that on behalf of your group. So in the end, there would be one report that will come back to Bob, from the readiness owners, so we don't have, a gazillion of these things. It becomes consolidated. We're really looking at the readiness owners to facilitate the visits up there and then also collect the feedback from the peers that are part of that visit and produce like one consolidated report back from that. So I just wanted to do that as a clarity. And I think in doing that, you want to make sure that the folks that you communicate with realize that they should send you their information sort of like in an electronic manner, so you can, they can put in as much information as they feel is necessary. They're not confined to just the small boxes on this sample printed report that you're looking at. So.
This is Kathy Russell-Babin. Is there any way we could find out who did site visits on the selection end? It might be better to have some of those people on our peer work groups, so that, because they'd have a running sense of how the system looks. I've never seen it.
Yeah, and I honestly, I'm not familiar with the groups that went up in the end. Even when that was under, when that was helping, when that was going through, I wasn't part of that effort. So I don't know. I think we could find out. I don't know if I would want to go back to that necessarily. I think, we want to, because the folks that have been named now as readiness owners have been purposely put there to kind of stay in that role through the project.
No, I don't mean that, but in terms of taking peers up with us to the site visit.
Yeah.
I
could.
Kathy, it's Jen Bradle. The people that went up to visit, when we went, it was to decide between Hackensack and or Cerner. Those site visits were to visit a hospital that had Epic and then go see a hospital that had Cerner. They weren't anybody that is involved in it now.
Actually, this is Shannon Marek. I am a readiness owner for Optime, and I did go on the site visit.
Well, I mean, I did too, but I think a lot of people, I didn't go to Cerner.
It wasn't really informative. Like, it really, honestly, to go back to that, it wouldn't really benefit us.
To the people, right?
Yeah.
Yeah, and I think the group that's going up now, you're going to get much more detailed. You're going to really be spending quality time, like full days, if you will, in that area.
Yeah.
And so you're probably going to get to a far deeper level than whatever was even gleaned at before. So.
But in conjunction, kind of what Kathy's saying, this is Jennifer again from Riverview, picking the peer people. I mean, I don't want to confuse and pick somebody that's a subject matter expert. So who do I pick as peer? Someone like myself in a role like me, or how does that happen? How does it? And then, like, Bayshore doesn't deliver babies, so I wouldn't even have anybody from Bayshore.
Right.
Right.
So
well,
how do you?
So that might be a little unusual in that Bayshore doesn't deliver babies, and so obviously there would be nobody in that role. But I would suggest that you would try to pick somebody in your role, because the list of job descriptions, for the readiness owner were initially provided to us from Epic, so there was a reason for that. So I would say that that's where I would start. I would try to get somebody from, each campus that has a similar role to yours, if you can. And if you can't find somebody that has the similar role, I would try to pick somebody, from that department after, you maybe discussing it with, the manager there or whatever. Now at Bayshore, even though they don't have, deliveries there, you may want to still get somebody to represent Bayshore. They may not necessarily know deliveries, but they may know, what happens if a patient happens to come into the emergency room and, is delivering a baby, and there may be some benefit to that. I'm not sure. You'd probably have to think that through and decide whether or not it makes sense or not. But so that's where I would start. And so the SMEs, or the subject matter experts, are not all included in this process, but they're also not excluded. If there is a SME on the list that would make a good peer for you to bring and bring into the work group, you're certainly welcome to do that.
Okay. Okay, and Well, the other question, and if mine are too specific, then please tell me and I can call Bob on the side, but like the Stork package, is it just obstetrics? What about neonatal? Is that come under peds or like NICU, or like, is that all part of the Stork package?
Joy, are you on the line?
Yes, I am. I can answer to that. Yes, it is. So I would make sure you bring your NICU nurses with you.
Well, somebody that would be in like my role, like Lori Messer.
Yeah, but it doesn't have to necessarily, you can think of some people that really know the workflow. So you might decide to use an assistant nurse manager, say from Jersey Shore, you know, and then at BRIC or OMC, you know, somebody there that knows NICU. A frequent charge nurse doesn't necessarily have to be an educator.
Right, but the group is limited, so it really needs to be somebody that's an expert in NICU, and then somebody that knows your hospital and what you do in all three areas, Joy, right, like OMC?
Right, right. I just know that just because, you know, I know the area, there's not necessarily somebody in your role and all the other
right.
sectors, so that's why I said that.
And you know, if you want to, you know, we can certainly, anybody, you know, can, you know, if you have those types of questions, even after you get off the line, or you're having some issues with regard to trying to decide who to select or whatever, you can certainly give myself or Joy or you know, anybody a call, and we'll try to help you and you know, work you through this. Don't you know, just, you know, muddle through it. If you're having issues, you know, don't spend a lot of time on it. Pick up the phone or shoot an email, and we'll try to you know, get you through whatever the issue is.
Yeah. And I think the one thing we just want to be conscious of is, you know, with the visits up there to Hackensack, to the extent possible, you want to try to have it so that your groups go up as a whole. But you can have a scenario where when you reach out to your Hackensack mentor, maybe a given department has I don't know, some constraints relevant to, you know, to size or timing, and they may say to you, you know, for this visit, can you kind of keep it to 4, and we'll do 2 visits of 4 each rather than 1 of 9. So you might get that. You might get some of that feedback from Hackensack. Like Bob mentioned earlier, we both have calls with them this week. You know, going over this type of stuff. We had high-level discussions with folks at Hackensack, but we're going to get into the folks who are the assigned Hackensack mentors to kind of prep them as well, like we're talking to you. And then going into this, we kind of know there may be a couple of departments that may give feedback to the Readiness owners and say, you know, given our size or given our whatever, it may be a constraint that's not related to size. You know, maybe bring up a couple teams of, you know, 4 each rather than 1 of 9. That's a possibility.
Well, we already know that the adult emergency department might be one of those areas. So, you know, we'll see. Yeah, we'll see how that plays out.
Yeah, it has to be worked out. But you'll do that. You'll do that, you know, fluidly and in conversation with the Hackensack mentor. You guys will, you know, work through that type of scheduling situations.
About who the Hackensack mentor is, and do we call them or do they call us?
No, you'll call them. You'll call them. So, you know, so after we have a couple of calls with them, just like we have a couple of calls with you guys, and there may be some early follow-up we have to do next week. That's why we updated the site visits to occur between March 28th to May 13th to give a little bit more time for folks to become aware that may miss some of these calls, right? But, you know, I'd say come March 28th, you could start reaching out to the Hackensack mentors. I imagine we'd be finished for sure with their notifications from it. And you have plenty of time to schedule it. So we realize there's, you know, lots of things going on. You know, people may have vacations or certain blackout things or so on and so forth. So that's quite a bit of time to maybe plan at least 2 visits. And I would also encourage you to kind of plan 2 visits really from the beginning. Because while you're there trying to set aside dates and times, it's kind of easier to do it once maybe rather than, you know, have to go back to the well and then figure out when that second visit is going to happen. You may just want to carve out those 2 from the get-go and know that you have them, and maybe give yourself time in between to have some internal discussions if you want to strategize about what to cover for the upcoming visit. But just a suggestion.
And how are we going to, oh, I'm sorry. How are we going to know who our counterpart at Hackensack is? How do we get that number?
Well, so what's going to happen is we're going to go over the next document, which is the master file of all of, I guess it's on your screen right now, of all of the team members, and we're going to go through what all the kind of different roles are. But on that document, there is the name of the Hackensack mentor and their email address. But in addition to that, we don't have it yet, but we hopefully will have it, as Bob said, fairly soon. We will have a contact phone number too. And we also will have contact phone numbers for your Meridian IT app lead. And then also on here towards the end, there's some other information about how to contact your system specialists or what is the other name for those, Bob?
Principal trainer. We're changing from principal trainer to system specialist, so you'll hear system specialist.
All right, because I'm looking at the spreadsheet, and I'm pediatric, so I have a very unique situation like Jen, where I kind of stand alone, and not all the hospitals have pediatrics even. They usually send them over here to Jersey Shore. Mm-hmm. So I don't see an email for a Hackensack person on my line.
Okay, so we'll have to take a look at that. I'm sure they have pediatrics, so let me just make a note. And there may be some other things like that where we'll have to get some additional contacts to represent some of those areas that are more specialty areas. But we can address all of that. So okay. I'm just going to walk you through. So the sheet that's up there now, or you may have printed it out, or you may have opened it up, it's called the Epic Master Document, and it has all these various columns. And in the headers for their columns, starting from the left side, it's broken out by the Epic application, so you can see hospital billing, you can see ADT, physician billing, that's on the first sheet. And on there, there's also a column that says champion. And the champion is the person who is pretty much totally responsible for that module, not from a technical or operational point of view, but they represent the module and sit on the steering committee for the EPIC project. And also were the ones who were very instrumental in identifying all of you, the readiness owners. So they function at a pretty high level. And then the next column over, you'll see, and this was mentioned earlier, this is the somebody have their mic on again because I'm hearing an echo again. Okay. You'll see the IT systems analyst. So that's the person that's the Meridian IT lead for your particular module or application. And we will give you contact information for that individual also, and that person will more than likely be involved with your site visit. And then as we move over, we have the column that says readiness leads, and that's where all of you sit. And right now on this phone call, it's basically all of the clinical readiness leads, but we know there's other readiness leads too that are associated with revenue cycle and whatnot. And so you can see that column, and those are the names of all the people that have a similar role to you. As we move further to the right, well, I don't want.
But what if you're the only name in that column?
If you're the so which one are you? We're talking about now?
The readiness owner. A lot of other sections in this spreadsheet under that column that have many people. But when you get to the Stork package, you have Pat Dursky's, and it says OB nurse, and then under readiness owner, there's only one individual.
Right. So you're a team of one who's gonna reach out to I guess all the hospitals that that have an OB program and create your work group, and that will be the group that gets together to do the site visits.
Okay, I thought that's what I thought, that I would get everybody that I thought would be to go on this visit.
Mm-hmm. Right, right. What's a representative from each campus plus the 2 IT people, so you'll have a team of 9.
Okay, so there's only 1 IT person, though, on the stork package.
On this list, yes, but there's when we go back to the PowerPoint presentation, Bob has a slide at the end that also says who the system specialists are, too.
Okay.
And I think in your case, I think Pat Dursky's basically maybe wearing both hats. But in any case, but there's another deck there, another slide deck.
Okay.
And I'm going to apologize in advance, as Jameson. I'm supposed to be listed as the point of contact for the system specialist role fill-in for Stork right now. That's not listed on the slide, but I'm listed for a number of applications. But I will be the one that is listed and is the contact for that for now.
Okay. Okay, for now. Okay.
Okay. So moving further to the right, we'll see the column that says Hackensack Mentor. So that is the person who has been identified by Hackensack for you to get in touch with to schedule these site visits, and also they will either be the ones when you get to the site that will be guiding you along in your visit, or they will be assigning somebody from their department who will do that. And as you can see in the next column, there is an email address for each of those mentors. And then finally, we see the column that says subject matter experts, or SMEs, and all of the individuals that are appointed to that. Now, the SMEs are really individuals who will be brought in and out of work group sessions as you, the readiness owners, deem necessary. So you would be able to use them as much or as little as you thought you needed to, and obviously if there's not somebody on that list that meets your need, you would have the ability to reach out to somebody else to be able to give you the information that you need while trying to solve a problem or while trying to help with a build. So those SMEs, like I said, are really at the readiness owner's disposal. They would come in and out and be used as all of you see fit. So that's really kind of the whole hierarchy of the team and what the team looks like in general. And here again, maybe at this point, I'll pause again to see if there's any questions about that. We're gonna talk a little bit more after this about each role, like for instance the readiness owner and what the responsibilities are, and the SME and super user. So that will come, but I mean, I don't know if you have any questions, if anybody has any questions about this particular spreadsheet or anything on the spreadsheet.
I'm sorry, I do have this is Maureen from Raritan Bay. Back to when Sarah was talking about pediatrics, because under ours we have Epic Care inpatient, and then there's several sub-applications. Then, as she said, the sub-application starts with orthopedics, and then when you get over to the readiness owners, then you have all these other subdivisions on top of that, neuro, pediatrics, rehab. So will we be working all together, that group everything under orthopedics? Is that all under one sub-application?
So I'm trying to follow you here. So I'm looking at the Epicare inpatient.
And when you go down to Eric, the next column is Epic sub-application, and you have my chart bedside, Rover, I guess Haiku and Cantu, Care Everywhere, and orthopedics. And then when you go across, they have nothing under orthopedics, but then when you go across and you go to readiness leads, there's more readiness leads, as she said. So then is the pediatrics, for instance, what she's saying, is this part of the same sub-application as orthopedics, or is it its own application?
That's almost like a general resource. I know it's labeled poorly, but that's probably the best way to think of it, about that is just inpatient, right? So those are
orthopedics.
Different inpatient areas.
Okay, so then my question.
There's not a sub thing to orthopedics. Okay, I see your point. Yeah, that wasn't labeled well. Okay.
Yeah, so my question is then, would everybody who's under, say, orthopedics just said general inpatient, would we be working all together then with, me and Sarah and Tria? Would we all be going and looking at the inpatient portion of it together?
Yeah, and I think, that becomes too big of a group. And, when Bob and I were talking about this earlier, it would almost be best to do it role-based, so like, break it down and look at the hospitalist, right? In this example, I can't see the small print. I can't see the last name. Is it Wadwa?
Yeah, there's actually two lines for hospitalists. Yeah.
Right. Okay, 2 lines. So the hospitalist would that's interesting, 2 lines. They would basically put together their peer group and then go up as hospitalists, right? And then separate from that and distinct, the patient experience lead, Tria Diebert, right? She'd go ahead and try to identify who would be a peer group across the Meridian campuses and then go up as that peer group. Ken Suchek would do the same. Tria, Ken, and Sarah, you guys wouldn't work across each other. You just work within your own peer group. Does that make sense?
Okay. So they'll just go to their units.
Yeah. I guess when you guys are going up there and you're applying a lens to it, you're doing it from your role as that type of readiness lead.
And what we're expecting is after the first visit, that's kind of maybe going to dictate some changes. If there's changes that need to be made in the groups, or in what you're going to be looking at. We'll certainly, listen to that and try to respond to that so that we get a good overall, look at the system from all aspects.
Yeah, and I think going back to a question, I think it came from Sarah from Jersey Shore from Pete's before, there wasn't a Hackensack mentor named at that exact line level, I believe, and we'll get this clarified when we do the calls at Hackensack. I think Rosemary Hunt is acting as essential coordinator for all that inpatient stuff, and she'll be the one who will likely split out to specific people as she gets contacted. So.
Okay, so yeah, that was my question here, because then she's next to mine, so she would be the contact for all of these then.
I believe that's what their intention was when they only listed her up front, because I'm a little bit familiar with Rosemary, and she sort of is in a role like that where she's over a number of areas. So.
Okay, well that would make sense.
Kathy Russell-Babin. So is the Hackensack mentor and the subject matter expert supposed to be related to your field?
The mentor should be related to your field. The SME will not be related to your field. The SME is more of a subject matter expert that maybe work with your field and can inform you about that specific dimension.
Both of them?
Excuse me?
I have positions for both of those, and I'm nursing.
You're listed. So you're named in 2 spots. Yeah. So people like you a lot. I think that is possible. I mean, we had asked the champions to kind of limit that scenario where the readiness leads weren't doing double duty as SMEs or readiness leads. It's okay that you are. I mean, you sort of wear those 2 types of hats.
Not anymore. I'm nursing education and quality. I'm not evidence-based care anymore.
So you're saying this is wrong on here?
So that's still wrong?
If you're saying that those folks should be close to our field, I'm not clear that having doctors for my contacts is a match.
Oh, going across, you're saying like Carol Barsky, if your question is she's, well, yeah. Well, I guess that's something if you got a question like that, we can re-review that with Hackensack. But they actually had put names specific to those roles. So
my title's not quality manager; it's nursing education and quality. I'm really all about nursing.
That's why I'm thinking we're going to overlap, Kathy, like, because that's stuff that we work on all together.
That's what I thought. Yeah,
but
I thought Maureen and I would definitely overlap, so would Dawn Heath.
Yes.
Possibly Catherine Laurie. Not quite as much Sarah, but, you know, because PEDS has its own little database, if you will, but definitely all those other adult inpatient areas, we'd all be of the same, we'd all be looking at the same stuff.
Yeah, because even though they're different disciplines, they'd still require a lot of the same documentation.
Definitely more, not more.
I mean, I think that's okay. I mean, I think, so what we're trying to do is just to come up with those work groups, and if there's different work groups, if I'm understanding you, they're going to be looking at the similar or same things, you know, that's okay. I mean, if you're a readiness owner, you're going to want to still participate. You're not going to want to not bring a work group up there. So I think
perhaps Maureen and I could, Hoopka and I could talk, because it needs to be divided out. Medical workflows are different than surgical workflows, for example, and there's a lot of different policies in there. Maybe it's best we somehow figure out a way to partition some of this, because
I agree. It's almost like we have to subgroup our group because they all overlap, and then make sure we're all on the same page.
Well, that's perfect. That's what we're hoping, is that we're going to, you know, you'll start that dialogue. Now, like I said, these job descriptions were given to us from EPIC, but that doesn't mean that we can't, you know, play with them and make them so that they're more functional, and the way they're organized are more functional. So we would encourage you to do that type of thing, and to, you know, to get together and to make the whole thing make sense.
Of course, it does depend for me whether or not Maureen Sintich is wanting me to look at it from a quality orientation, in other words, quality reporting, or she wants me to look at it from clinical system, which I'll check on.
Yeah, we can work
with our champions.
Are there any other questions? I mean, there probably will be more questions, you know, after, you know, you get off the line. And certainly, if you can and you want to participate in tomorrow's phone call because you've thought of additional things, feel free to do that. And as I also mentioned, you can certainly reach out, you know, to me at any time, and I'll try to you know, work through with you any of the issues that you identified.
And Bob, just from a time check perspective, and I think we have this for an hour and a half. You still have those other slides to go through.
Yep. Yep. Okay, so we're just going to move on, and the next we're going to get into some of the roles, because there's some of the names that EPIC uses for these roles are not names that we would normally use in a hospital, or for that matter, some of these I've never heard before. So we just kind of want to, and you can certainly look at this at a later date. I'm going to kind of just go through this fairly briefly. So we'll start with the readiness owner or lead. Now, the reason why we have readiness owner or lead is because EPIC kind of uses those two words interchangeably, and we just wanted to make you aware of that, so that in your conversations with them at a future date, that you realize that that's really the same thing. So you know, we see the readiness owner as really the main point person who takes responsibility for making final decisions on operational issues involving their application or area. You know, some of the responsibilities are going to include developing this collaborative network of peers. It's going to be, you know, familiarizing themselves with the Hackensack build, completing the required EPIC e-learning, and we're going to move into that you know, right after this to let you know how to get onto the EPIC website. and to be able to access that. You would be scheduling the routine meetings in addition to the site visits for the operational groups. You'd also be participating in IT team meetings when requested. So there are IT work groups, and they may need your participation, your input with regard to how certain things should be developed or built, or to show you how something's working and get your feedback on it. So you'll also be involved with any testing efforts, reviewing training materials, and assisting in identification and recruiting of super users. That's a little bit down the line yet, but that's certainly going to be a big part of, an important part of the whole implementation phase. And so that's kind of the readiness owner. That's your area. Now the subject matter experts, or SMEs, so as we mentioned, so they serve as a resource to you, the readiness owners, and they would participate in ad hoc meetings as requested by you. So they're really the ones who would be utilized to discuss detailed topics or questions that are specific to their area. They would also participate in testing efforts and provide operational expertise to the training team to make sure the training program is relevant to staff and that it will be effective in preparing them for go live. And so that's kind of the difference between you, the readiness owner, who's going to be responsible for making some final decisions, and the subject matter experts who will be brought in for their detailed knowledge in helping you to get the information that you would need to make some of those decisions. And then we're going to move on to the super users. I think that's a role that we all are kind of familiar with. So, basically, they assist in many of the aspects of the install. So that would be testing, training, workflow walkthroughs, dress rehearsals, go live support, change management, which I know a lot of you have been invited to some of those change management sessions, and communications. And so we're looking to, Epic has a calculator to try to calculate about how many super users we would need, and at first blush it looks like it could be just about 1,800. So that's an awful lot of super users that are going to have to be identified and eventually trained. Next page actually kind of gives us a profile of super users that Epic has found to be successful. Most of them are intuitive, knowledgeable in their field, competent in basic computer skills, positive about the Epic project, patient when teaching others, respected by their peers. And so, we're asking you, and you probably know a lot of these types of people already, but now that you will be, getting more involved and maybe making some visits to other campuses and, talking to other people, it's never too early to try to get a running list of people who might be good candidates for that particular position.
Are the super users campus specific, or will your expectation be of the super users to go anywhere and everywhere?
They're really campus specific largely. I mean, they're largely. I mean, there may be. I think when you get into you may get into situations where they're trying to cover, so, but mostly think of it as a campus. Like when we've done our super user support in the past, we try to take from the campus, but we ask other campuses to help out, in the current state of things. Raritan Bay, would be the first campus, and after that, everyone else is kind of go big bang. And in that arena of big bang, then each campus sort of has to identify their own super users.
So so the answer is that for the most part, we're expecting that for the most part they'll be on their own campus. You know, if there's a need where there's a shortage in, for whatever reason in one area on one campus, and you have that type of background, you might be asked whether you'd be willing to help them out. But besides that, probably pretty much the same, confined to a particular campus. Other questions about those roles? Okay, so we're going to move on to the next slide, which is really how to gain access to the EPIC website. And you can see that there is an address that you would go to request an account. And it's very important that you, if we go to the next slide, it's very important that you use, if you have other types of email addresses, especially some of the physicians, it's very important that you use the Meridian Health email address, because that's the way the EPIC website controls who comes into that site and who should have access to that site. So you have to use your Meridian email address. It's a fairly simple process. You fill out the information that you see on that next slide we're on, and then once you get into the site, there's various sections in there. There's a networking hub. There's EPIC's documentation hub. There's a community library. There's training. So there's a wealth of information on that website. And then if we go to the next slide, we talked about e-learning, or what they call we-learning. This slide just kind of shows you, once you get in there, what that's going to look like and where to go to find that training and the we-learning. There are a lot of available lessons, and EPIC has provided a curriculum identifying recommended end-user courses by your role. So those are things that, and we're going to show you a list of your application system specialists. Those are things that your application system specialists can help you with. A lot of them are familiar with which of these sessions or e-learnings are better than others. They can also help you if you're having problems for whatever reason trying to get in there and to utilize some of that material.
741-2700 and ask for extension 1111 or visit the concierge desk in the Marshall lobby.
Oh, geez, somebody put us on hold.
Yeah.
Okay, so quickly, because
wasn't me.
Quickly, because we are getting towards
They've been
the end.
muted, sorry.
Do you have any questions about the e-learning? I think if you follow the slides, I think you should be able to get in, and certainly reach out to your system specialists that are listed there to help you through that. They'll be more than happy
to
do that.
So just a commentary to tie the two documents together. So in that master spreadsheet that you showed earlier, where you had the readiness leads, there was a column that was in that spreadsheet that said e-learning, if there's e-learning that's required. And so if there's something if it's listed as a Y in that column as yes, and some I guess they recommend it, then clearly you want to, there's e-learning that you should be paying attention to on the EPIC website. Not everybody has e-learning, but I just want to give that as a guideline. So.
Hey, Bob, I'm not a Meridian employee. I can't access that e-learning.
Well, yeah, Dr. Sherrill, this e-learning is on the EPIC site. So
okay.
It's not the HealthStream e-learning. It's that other PowerPoint where Bob was saying where you create an ID. So you definitely you must have a Meridian network account, right? Which is your ID account.
Yep.
So when you go to that slide where Bob was showing how to request for an EPIC web account, you would put in, I'm assuming it's vsorelli@meridianhealth.com or whatever. You you would put in that information in there, and then why, and this is the other thing that we got to make sure you're aware of, just as for you, but anybody, but Epic has this configured in such a way that you only can access their Epic user web from a Meridian network. So if you are, at your friend's house logging on to their computer, it won't let you go in. You have to go through remote. You can go through remote.meridianhealth.com and then hit it, and then that would be fine. But you couldn't hit the URL cold outside of the Meridian network. So they just do that, I guess, to help safeguard their information, I guess. But
when they ask you on the website for your role, do you put in your role as a readiness owner or your role here in the organization?
I think that's a great place to say readiness owner.
Yeah,
I
agree.
Yeah, I think that's a good thing. I mean, it's really informational for the person on the Epic side who's processing these requests. So there's really no wrong answer in that box. But I would encourage you to put your role in the project. That can't hurt.
Any other questions with regard to that? Here again, if you have any issues, reach out to your system specialist. Now moving on to the last section, which should be pretty brief. So we just wanted to mention some of the Meridian Epic-related communication tools that either are developed or are in the process of being developed. For those of you who haven't seen, on Meridian's intranet, there's a Bada Boom website, which has recently been populated with a lot more information, and certainly can, in some cases can have information that is going to be very helpful to you, and that's a place where if there's things coming up or events, we're going to try to make sure that we update that on a continuous basis. And then I also mentioned that marketing is working on compiling a master Epic implementation team contact list. So that would be, we would try to make that available to you, so you would have an email, the name of the contact, their role, the email address for that contact, and a contact phone number, so that it'll be easier for you to start making some of these introductions and trying to arrange for some of these meetings, and just in general, as the project goes along, there's probably sometimes going to be a need for a specific person with a specific type of information, which may be in a different module than yours, and it will be very easy for you to identify those people. And the prototype that we saw so far is basically one that has tabs on the bottom and is separated by module, so that you could easily hit that tab and then see all the resources and contact people with their information by module.
And they're going to put that on the Bada Boom intranet site, so it's in the central spot. So that will be easy to access. And then the last thing is there's a product called SharePoint, which you can also access from the Bada Boom website, and there will be important information and meeting minutes and documents on there that get populated as we go along, and that'll be something that you'll want to just take a look at. And I think at the moment there's a lot of documentation that's on that SharePoint site. Most of it is technical in nature, and I had asked someone put together sort of like a tip sheet how to access it. I think at this stage there's nothing there for you to be concerned of, but I think as we come through these site visits and have the site visit reports returned back, that's an example where we would publish them all up on SharePoint, and so it becomes a document that's accessible to the full team across the board, as an example of how SharePoint may come into play for you guys.
It's a slide titled System Specialist. When you look at Epic Care Ambulatory, Epic Care Inpatient, so the inpatient is where all the other packages would be, correct?
Yeah, you mean like, you know, yeah, pretty much, yes. You know, so in neuro, you know, any of the inpatient areas, you know, medicine, surgery, you know, so on and so forth, that's all sort of collapsed under inpatient.
So that's where the stork is, right, on the inpatient
That's where,
side?
yeah. Stork is a little bit of an odd egg in the world of Epic. We see it two ways. We see it sometimes by itself, and we see it collapsed in inpatient. You know, in the project staffing chart, Epic just has one Stork resource, and the other resource is expected to come out of Epic Care inpatient, sort of like on a you know, as needed basis and stuff like that. So I think, you know, Jameson, as much as you had offered to be that person for Stork in the meantime, we may want to look at maybe perhaps Diane Martin could fill that role into an interim, just, you know, because it's really nurse to nurse, that type of thing.
Can I ask a quick question?
Sure.
This is Shannon from Jersey Shore. Are the Readiness Owners going to be being sent out to Wisconsin?
Yeah, not for any of the clinical folks. Some of the financial folks have to go, but there's not much of that. And the ones who had to go were informed in December.
Okay, good.
So yeah, you'll see, and that spreadsheet like Bob's showing right now at Epic Training was a yes. There are a few in there, and they're all on the financial side.
Okay.
Any other final questions?
So is the Jumping Brook on the 18th of April, correct?
Right. So the sessions at Jumping Brook. So in this project structure, Dr. Scott is the champion relevant to clinical standardization and quality, and in that role, Dr. Scott thought it would be good to provide change management education to the group, and so that's the context of that. So I think there was one session that happened, it might have been yesterday, was the first one.
Today.
Yeah, and okay, and then others are coming. So, and that's really just, it's more, I don't want to speak too much on behalf of Dr. Scott because I think it was his feeling on that, but it's more just to provide information to give you guys some knowledge and tools about change itself. You know, I think it's safe to say, you know, regardless of, you know, of anything, there's going to be change, right? So I think it's just he was trying to teach some concepts relevant to change management. So more of a generic tool than anything very specific to Epic. You know.
Any other questions?
Does Meridian transportation up to Hackensack?
Say that again? I'm sorry.
Does Meridian assist or provide or help with the transportation of your group going to Hackensack?
No, that would be, you know, sort of independent of individuals. So, you know, people just could meet there. I mean, I don't think you have to go as far as each readiness owner can decide how they want to handle it. I mean, everyone's very different in those types of things. You know, people come from all sorts of directions, so, you know, they may just as well assume to meet there as opposed to gather and go. But that's something you could work out, you know.
An all-day visit?
I would say I would encourage you. Yes, I mean, you know, looking at the agenda items that Bob had suggested, you know, for visit 1 and visit 2, it probably would be a full day. You don't. The thing I would kind of say up front is that you don't want to minimize going up there. I think it's a great opportunity, and you're there. You really should try to get the most out of it. I wouldn't just go there and say, oh, we can get out of here in 2 hours and we'll be good. I would try to say, no, I would camp out. I'd bring a water bottle and some crackers and stay there. You know, I would.
Well, the reason I'm asking, we have to confer this with people that we report to in order to be able to be let out of the building for an 8-hour day. I want to know. Yeah. That's why I'm asking. I need to say to someone in particular, I have to be gone all day.
Oh, yeah. I would say these are all-day visits. I mean, but a lot of it, you know, remember one of the bullet points here is when the instructions that are readiness owners is, I'm trying to see which one it is right now. It says contact the designated Hackensack mentor in advance of your visit to discuss topics and review who is arriving and expectations. So, you know, in your discussion with Hackensack mentor, they may say, you know, if this is a day everyone can go, we only could do a half day on this particular day. You know, so I don't want to tell you it's always going to be a full day. I think it's really what ends up getting worked out, you know, as you have those discussions with them. You know, I think it's in everybody's best interest to kind of make it a full day, because then you can minimize your trips going up and more, you know, efficient for everybody if that's possible. But it may not be possible for some different kind of constraints. So.
Hi, I just have a question. It's Dawn. I have the Cupid Cardiology. Being that they're not rolling it out till April 1st, how soon after that do you suggest, you know, should I give them 2 weeks and maybe go mid-April, or?
I would reach out to them ahead of that and try to get tied into their go live, right, to be a presence there, and then even beyond that, for those in-flight projects, I think I mentioned it quickly earlier, is our analysts are starting to spend time while they're building Cupid to be part of that effort, so we can apply, you know, what we've learned. And we had to ask Hackensack to spend time here as we spend time there. And when they're here, we're trying to find opportunities to kind of engage in those readiness owners from those apps, so that you guys can start getting it a little bit more directly involved. I mean, because in those apps they're being created, or in many cases they're towards the tail end of it, quite honestly. But you know, there's still an opportunity to become aware and engage in conversation. You're not going to, if you go to Hackensack ahead of them going live, you're not going to see anything live. It's only, you know, it's only after that point. But I would say definitely try to get further go live. I mean, there's no better experience than going through someone's go live.
Okay, excellent. Thank you.
Other questions? Well, thank you, everybody, and hopefully this was helpful. If you think of other questions or need some clarification, again, don't hesitate to contact myself or, you know, one of the other people that we are going to give you contact information for. And
the one thing I just would want to add to that is just be mindful that as we're reaching out to you guys now to put you in a loop, we have a couple more of these to do, and then we also have to do them with Hackensack. And then on Monday, we're pulling together our app leads and system specialists. So I think you may just want to, you know, I wouldn't call Hackensack until you get the final high sigh from Bob. You know, we're expecting that to be, quite honestly, very soon. But, you know, I would say, you know, look for that. On our visit report, we're saying, you know, the visits would start really March, the correct slide is March 28th, around that time. So you have a little time. I don't want everyone to hang up and then reach out right away and give us a chance to go through this communication like we're going through with you guys. So.
But certainly you can contact me if you have questions, and we'll try to work through it.
And you can think about your peer group. I think in the interim in this week or so, you know, start thinking about who your peer would be, from who you want to accompany you on your visit to Hackensack. I think that's definitely stuff you can do and reach out about. So.
Yeah, I mean, some of you already know your counterparts at the other sites because you have conversations or you're in professional associations where you meet them or whatnot. But even if you don't, I'm sure that it'll be fairly easy for you to try to identify your counterpart or peer or whoever it is that you're going to help you form this work group with.
Hi guys, to confirm from the beginning of your conversation, so we're to get a peer from every campus, and then our IT person goes with us as well. Is that correct?
Two IT people, yeah.
Yeah, 2 IT people, yeah. So, you know, there'll be an app lead, right, and there'll be a system specialist. So in most cases, we have a couple areas that do not have a system specialist, but most do. But yeah, it'll be two from IT.
Thanks.
Okay, everybody, if there's no more questions, thank you very much. I look forward to working with you all.
Thank you.
Okay. Thank you. Have a good day.
Thank you.
Have a good day.